A breast reduction with breast implants is a procedure that's not performed commonly in my practice. The reason for that is if you think about a breast reduction, the idea of the breast reduction is to remove skin and breast tissue. You're effectively reducing the volume of the breasts. If you use an implant, you're actually attempting to increase the volume of the breasts. So they're really two different procedures. Now, there is a situation where if you have a breast that's comprised primarily of skin, lacking in volume from breast tissue, then removing that skin may contribute to a reduction, requiring some supportive feature to replace the volume that allows projection of the breast, and an implant in that situation may be necessary. So counterintuitive, but nevertheless there are options and there are situations which may require the use of an implant with reduction.